Well, I'm at the hospital. I am in the pre-op area. Just got on my lovely gown and showered this morning. Did not put any makeup on. Not trying to impress anybody here. And soon they'll come back and start the IV, and I should be heading off to the races. So, wish me luck. God's in charge. And I'm ready to start the new me. See you on the other side. Well, here I am. I am, how many hours post-op? Probably 6 hours post-op? No, not even that. I'm sorry, 3 hours post-op. I've just had my first walk, and my goal is to be home within a day. They wrote it on the board. I brushed my teeth. I will say the absolute, the pain's not too bad. They're giving me pain medicine and nausea medicine. The part that's bothering me the most is the really dry mouth, and they won't let me use the biotin spray. I did buy some at other people's suggestion to buy biotin spray, so but I can't use that yet. But they did let me brush my teeth. I couldn't swallow the water, and I have a little thing that they let me here, like swab in my mouth to keep it from being so dry. But otherwise, I'm okay. I mean, I did my first walk. The only real pain that I'm noticing is I can't take a really deep breath, and I think it's because of all the gas that's up in my shoulders and my chest area. So I'm really looking forward to the gas going away. And they're asking me to walk 3 times a day. And I just had my first one. It was only about, I don't know, 3.5, 4 hours post-op. I honestly don't even know when I got out of surgery. But I've been up in my room for at least 2 hours. So we'll see. We're on the way. I should be in Wonderland in a week, I think. All right, bye. Well, I've got my good friend, Mr. IV Pole, and we are headed out on walk number 2. The 7th floor of Rex Hospital, where all the bariatric patients are. No, nothing for me yet. Thanks for that education. Day 2 post-op. Had a pretty good night. The worst pain was definitely in gas pain. It wasn't unbearable, but that was the biggest problem, and a lot of gas pain like up here in my neck and shoulder, as I shared earlier. So really that was the worst of it. I didn't sleep a ton, but who sleeps and rests in a hospital? Not many people. But the great news is I have my first ounce real water this morning. So all the dry mouth from yesterday, which I'm sure comes from the pain medication or whatever they're giving me in the IV, it makes your mouth so dry. I'm actually not been on any narcotic pain medicine. I've been on liquid Tylenol or through the IV, and Torbidol. That might be even the same thing. I don't know enough about my pain medication. And then they've been giving me antibiotics for the past 24 hours, but I'm done with that. She said she gave me the last dose of antibiotic. I only had one shot pre-op of Lovenox, which is the blood thinner, and I won't have to do that anymore. That was just pre-op. And then I'm using my, what do they call this, a spirometer to expand my lungs, so I'm doing that regularly, and hopefully I'll see the doc soon. I figured it's almost 8 a.m. I thought he would have rounded already, but he should be coming in soon. So far so good. I sipped that first ounce very slowly, and took a walk, did a couple of laps up and down the hall, met another fellow patient doing her laps, and only thing I noticed is maybe some stomach cramping. I have 6 incisions that I haven't really thoroughly looked at yet. They are all closed on the outside with glue, so there's no stitches. And I'm told they look great. I haven't seen them, but I'll take their word for it that they look good. So everybody's been wonderful. The nursing staff, the PAs, everybody, the nurse aides have been great. So far, so good.